Here in Canada, refugee health is under attack. We like to think that we are a welcoming and accepting country, but Bill C-31 and recent cuts to refugee health coverage are moving us in the opposite direction.
The Interim Federal Health Plan, or IFHP for short, provides health coverage for refugees from when they get to Canada until they qualify for a provincial health plan. Before the cuts, all refugees got the same coverage, including some extended medical benefits like vision and dental care. Now, asylum seekers and many privately sponsored refugees get no extended medical benefits from the IFHP. This meant that a Saskatchewan man didn't get coverage for anti-nausea medication for his chemotherapy. There was no way he could have afforded it otherwise. If the provincial government hadn't stepped in to pay for it, who knows if he would have made it through chemotherapy.
The Canadian government argues that these changes are just. Why should refugees receive extended medical benefits that Canadian citizens don't? In reality, what these refugees are receiving is roughly the same as what Canadian citizens will receive on social assistance. They're not going out and getting gold-plated dental fillings, they're simply receiving basic care. These people came to Canada to make a new life for themselves and their families, but they need our help to get back on their feet, and I think they deserve it.
We'll save $100 million over the next 5 years with these cuts. Seems like a lot, but how much is this really? It's only 59 cents per Canadian per year. 59 cents! That's it! And to put this into perspective, the Canadian government has overspent their advertising budget by $128 million during their first 5 years in office.
Bill C-31 has a list of countries called Designated Countries of Origin that are considered safe, such as the USA. But not all refugees are safe returning back to these countries, like Mexico. These refugees and failed refugee claimants get for health care only if their illness is deemed a public threat. Thus, tuberculosis will be covered, but a pregnancy complication will not. This is not the Canada we thought we knew.
These new policy changes are supposed to make it so that bogus refugees don't take advantage of us. But here's the thing, how many refugees come all the way to Canada, away from their homes, their families, just to take advantage of Canadians? It seems kind of paranoid. There will always be some people who will take advantage of our system, but the question is, how many innocent people will we have to hurt to make sure that this doesn't happen?
We've only told you one refugee health story. How many more are there? Is this the type of country that we want to live in? Let's stand up for a Canada that's compassionate and humanitarian. Rise up and speak out on this issue. It's important. Sign petitions, write letters to your MP, go on marches, and stay informed. Let's make healthcare truly universal again.